Hi, so my name's Elijah. I'm a medical health psychology intern over at the University of Florida. And if you're reading this, then I'm dead. Dead set that coming to the University of Florida was a great decision for internship. I actually have never made an Instagram post before or much of any kind of social media, but this internship's been really good to me. And they said they needed someone to just kind of walk you through a day in the life, so I volunteered. Okay, so we got DG66 here. This is our office. Some say the best office. Got a carpet. We're pretty big on soft lighting here just because we're all day, every day, and hospital lights are everywhere. Corkboard over there. So I know this looks like a lot, but I promise there's a system. Just things I need to memorize for A1C target levels, some of the scoring measures, some advice when it comes to writing reports. Can't put anything in the walls, but there are already some holes in there from previous paintings. So we just reinserted them, put our own ones in. And we got our own Hailey from the child area. Hey, Hailey.
Hi.
And so I want to ask, what kind of stuff are you working on today?
Well, I had a series of meetings. We started our child and pediatric meeting at 9 this morning. I went into an internship Q&A that we were holding for outgoing intern graduate students here at UF. I had a multidisciplinary neurodevelopmental meeting that I attended at 11. We had some didactics earlier, kind of like for the entire area, as well as like specific to interns. And so I have a break before I do some tiered supervision with a graduate student in about 30 minutes or so. When I'm in the office, I'm usually prepping for my treatment cases. I'm usually kind of looking through some different protocols and kind of planning here in the office. And I also write a lot of neurodevelopmental reports too. So I'm here looking at kind of some results, integrating those into our comprehensive reports, and then sending them over to my supervisor to collaborate on.
Cool. Thanks, Hailey.
Mm-hmm.
All right, and this is DG65. It's the one right next to our office. That plant is not real, but still matters. So we call this one the cubicle office because they have little cubicles. You can hang things on the wall. You got some space for storage. Pretty fun to decorate too. We're pretty big on soft light around here. And then of course, printer, more storage, got a fridge and a microwave and some cleaning products. Welcome to DG65. All right, and this is DG62, and this is our biggest office, and so it's got 4 separate tables as part of it. Nice little corkboard over there with all of Harangi's thoughts. So everybody does get 2 computers, and if you get in this office, you do get a giant whiteboard, a sink, and a microwave, and a lot of cabinetry. Not included is George Gion. Hey, George.
Hey, how you doing, man?
Good, brother. So what are you working on today?
Couple reports, some patient notes, you know, the fun things.
Right on, right on. And what would you say is probably the busiest part of your week and the least busy part of your week?
Yeah. Busiest part is probably working over at Fixel and working over here doing neuropsych assessments. Takes a little bit of time to do each one of those, but we got a lot of psychometry support. And then least busy part is all the days that I get to stay at home and write.
Nice. Well, thanks, George.
Thanks, bro.
And so yeah, we always have postdocs available too, people in our specific area. We go to cases with them, they supervise us, give us feedback on reports. So current postdocs are Drs. Etzel, Kaplan, and Ruiz. Oh, hey Dr. Ruiz, how are you doing?
Oh, good. How are you doing?
Doing pretty good, pretty good. So, want to check, Dr. Ruiz is actually a former intern here at UF and stayed on for postdoc.
Yes.
And I wonder if you can talk a little about your typical day as an intern and then how that changed as you became a postdoc.
So as an intern, my week really varied day to day depending on the rotation I was on. So as you know, and as you probably told, people were considering UF already, that you get a lot of experiences at one time. You're on bariatrics, chronic pain, oncology, transplant. And so as an intern, my day really varied. It was a lot of assessments, a lot of direct patient care.
Mm-hmm.
As a fellow, I was able to specialize more in what I wanted to do. So I split my time between transplant and oncology. And so for the transplant service, my day could depend. I might be on outpatient cases and doing assessments. I could be on inpatient up on the floors, seeing people bedside. I could be in medical review boards working with the team about like a patient's status, their risk factors, like psychosocial risk factors. And then on oncology, it's a pretty busy day. We have quite a few patients that we pack into one day. And so I do a lot of pre and post supervision with interns, with not postdocs, I'm the postdoc, with interns and grad students, and help manage kind of the caseload for the day, see patients myself. And then when I have a moment where I'm not seeing a patient, it's mostly report writing and catching up on notes.
Cool. Well, thank you, Doctor.
Mm-hmm.